The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with the Genuine Article, and today I'm talking with Dr. Partho Sengupta. Dr. Sengupta is Assistant Professor of Medicine at the Mayo Clinic Medical School, and he's at the Phoenix, Arizona Mayo Center. Dr. Sengupta and his colleagues are about to publish a really interesting paper in JACC that deals with the issue of the role of obstructive sleep apnea in patients with hypertrophic cardiomyopathy. How did this topic come to your attention, Dr. Sengupta?
Thank you, Tony. Actually, this is incident to 4 case reports that we previously published earlier this year regarding 4 patients with hypertrophic cardiomyopathy who were referred for septal reduction therapy, and they were extremely symptomatic. And we discovered that they were having a sleep apnea, and then when we started them on the therapy, they had marked improvement in their symptoms. And that's how we started wondering whether there is a high prevalence of sleep apnea, and what it has to offer with regards to management of patients needs to be systematically looked at. That's the reason we had this study.
Well, just thinking about it, the pathophysiology of obstructive sleep apnea with its hyperadrenergic surges might be particularly detrimental to patients with hypertrophic cardiomyopathy.
That's correct. In fact, the hyperadrenergic drive is a major problem with regards to the pathophysiology of hypertrophic obstructive cardiomyopathy, and that's exactly the reason these 2 conditions might be a bit of a problem if they coexist, and they're very fairly common. If you see the community studies, hypertrophic cardiomyopathy is a common problem, so is obstructive sleep apnea.
Now, when you screened your patients, how prevalent is sleep apnea in the hypertrophic cardiomyopathy population?
So in this particular study, we took 100 consecutive patients with hypertrophic cardiomyopathy who attended at Mayo Clinic Rochester and Mayo Clinic Arizona. And we used oximetry to look into just the prevalence of abnormal oximetry patterns. And we were surprised to see a presence of 79% of the patients having abnormal oximetry, which was suggestive of a sleep disorder breathing.
Yeah, now what about the general population? How does that compare?
Now, in general population, if you look into obstructive sleep apnea, the estimates are that 1 in 5 individual above the age of 65 has probably has obstructive sleep apnea or a sleep disorder breathing of some format. Now, having stated that, the prevalence increases in tertiary care referral centers, and particularly the control population where we try to match with hypertension, obesity, we found the prevalence was 49%. But again, the sleep apnea prevalence was higher, significantly higher for hypertrophic obstructive cardiomyopathy.
So higher for hypertrophs, almost unbelievable, really. 80% of hypertrophs having obstructive sleep apnea. That's shocking that the prevalence should be that high in that population. Could it be that the fact that you didn't do polysomnography led you to overestimate the prevalence?
So the estimate was 71%, if I can correct you, but we did a subset of patients, 24 patients from these who went into polysomnography, and obstructive sleep apnea was confirmed in 23 of these 24 patients. So 96% of them actually had evidence of obstructive sleep apnea on the polysomnograms.
So it's clear that obstructive sleep apnea really is prevalent in the hypertrophic cardiomyopathy population, that it likely contributes to symptoms, and in fact from your previous work that a successful treatment of the sleep apnea really does improve the patients with hypertrophic cardiomyopathy. Thanks so much for this important insight. And for the Genuine Article, I'm Tony DeMaria.
The Genuine Article. Discussion and commentary based on articles from JACC.